Do 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 do. Da 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 da. Do 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 do. Ta! Hi guys. I'm here to tell you about the Bay Area Functional Performance Evaluation Tool, or BaFPE for short. So when I first opened up this big black box, I got really excited because it looked like a really cool and fun tool to administer. But then once I got to see the FIM and the amps and some of the other ones, I kind of realized that the BaFPE is kind of a little bit lame. I could see how it may not get to the point as well as some of the other ones. But anyway, let me tell you about it. So it was developed originally in 1977, just like many of the other tools, to assess, to come up with a standardized way of assessing for broad aspects of functional performance that is necessary for ADLs and IEDLs. And the idea is that it should measure motor, psychological, social, cognitive, performance components of the client. The theoretical base is that it's based on occupational behavioral frame of reference and the acquisitional and occupational behavior frame of reference. I'm not sure what that is. Maybe Scott can tell you. It was developed before the days of the PO and that kind of stuff, so they used other frames of reference at the time. But the general premise is that functional performance is measurable, and if we can measure a person's functional performance, then we could, and since the function is precursor to occupation, then we can see how this person is going to perform occupationally, once they go home in their real environment. And that's the general idea. So it consists of two parts. One part is sort of this side of the box, which is the task-oriented assessment, or the TOA for short. It consists of 5 task-oriented activities, and it's measured by 12 functional parameters. I'll tell you what they are later. And the second half is sort of like this part of the box, is the social interaction scale, or SIS for short. And that is measured in 5 natural social settings, and each one of the social settings is measured, is scored within 7 social parameters. So a little bit more of the history. The original version came out in 1978, and the idea was to have one single score for both of the parts, and sort of, that would be the patient's score. But then later studies showed that the single score was a little bit biased towards the SIS, towards the social interaction scale part of it. So 11 years later, in 1987, the same guys came out with a second edition, and they basically kept all the activities the same, some minor changes, but they broke down the score into 2 separate parts. We have one separate score for the task-oriented assessment and a separate score for the social interaction scale. In terms of psychometrics, it's got some really good psychometrics, but also some pretty bad. Let me start with the good. So it's got excellent inter-rater reliability, which means that if I measure it and somebody else measures the same client, we'll get a very similar score. It has pretty good concurrent validity, which means that there's a positive correlation between this test and other sort of established tests, such as Global Assessment Scale and the Functional Life Scale. I don't know if they're still used, but that's what they used back then. And that's good because they have generally positive correlation with other tools, but it's not like a one-to-one correlation. So it measures in the correct direction, but not it's not exactly like another tool. It also has good construct validity, which means that there's poor correlations between the two parts of it. So the five task-oriented activities do not correlate with the social scale, which is very good. It means they're measuring two different things, and also within each one of the parts, it has poor correlation between the different items of each one of the parts, which is also good. It means that each one of the items, each one of the social items, measures a different category. Let's talk about some of the negative psychometrics. So it apparently has a certain degree of social bias. There's a very interesting study done that showed that Canadian clients, for some reason, scored significantly lower than their American counterparts, and the only explanation that they were able to give is that it's somehow culturally biased. So in Canada, from what I know, the culture in Canada is relatively similar to the American culture, but you can imagine if you administer the tool to someone who's an immigrant, it could really screw up the score. Another one is that it's got a poor intra-rater reliability, which means that at least in the beginning, the therapist needs to be trained in how to administer the tool. So if I give this tool to a client today, and then I do it again, I guess to the same client, I don't know, a couple of days later, I'll get a relatively different score, which isn't very good. So it means that the therapists need to be trained in how to administer the tool, not extensively, but a little bit. It's not very good. And the biggest negative part is that the norms for the tests are very few. Even though it's been around since 77 or 78, it seems that they've had a lot of trouble calculating norms for different populations. And that's partly because it's just so long that a lot of people don't adhere to the entire tool, and they sort of omit things and they change things a little bit. A lot of places, I've read one of the studies shows that they sort of do the five functional tasks, but they completely omit the second part, because the rationale is that they observe the patients in groups anyway, so why do this? That's part of what we do anyways. So badly established norms. Okay, so let me go through a little bit of the administration. So again, the first part is the 5 tasks, and they consist of shells. So just like with much of the other tools that we've seen so far, there are very direct verbatim instructions that the therapist has to follow. Like, you have 1 minute left, your time is up, are you finished? I'm sorry, but it's time to stop working now, that kind of stuff. Which kind of makes it very dry and I guess less fun to administer. So where was I? Okay, so shells. So you give the client shells. They have to. This is really cool. I don't know if you guys can see it. There's like a whole bunch of different shells in here, different shapes, sizes, colors. I guess shape, sizes, and colors. Yeah. So the client has to break down you sort the shells by different shapes, colors. I'm missing one of them. Sizes. And then for each one of the 5 tasks, there's 12 parameters by which you rate the client. So the 5 parameters break down into 3. Oops. Let me restart. Watch the next video. I'm gonna pause this one.